Okay, good morning, everybody. I am with Gavin Barney.
That's correct. Yes. Good morning.
And Gavin, what's your title?
I'm a senior insurance advisor.
Okay. And so, I have been doing a lot of videos on, because it's Adventures Over 50.
Hmm.
And so I've talked to my friend Ron, who's a probate attorney,
Okay.
because a lot of people, and then Jenny, she's a senior living expert. And because these are the things now at 58 that I'm dealing with
Sure.
that I don't even know about.
Hmm.
And then I've gotten a lot of questions from other people, and a lot of them were writing me to say, could you please explain, like, because Medicare, and I tell you, I don't know anything about it, the parts,
Sure.
the
Yeah.
parts. And so, so we were sitting around and we were like, oh, what do you do? And they're like, oh, we're in insurance. You're the people I
There
wanted to
you
talk
go.
to.
There you go.
So I'm not going to do much talking, but listen, uh, like I said, I am getting to the point where I'm going to have to know all this
Sure.
stuff too. And my mom's on it and I don't even understand it.
Hmm.
It's really, I think, to the layman that
It can be daunting. It can be very difficult to try to
complicate.
understand. And I
Yes.
think one of the major reasons for that is that when you're getting close to Medicare, you get inundated
Yeah.
by everybody,
Right.
both local and all over the United States, with information saying this is what you need to do. And
Right.
it's a different course of action than what you've experienced up to that point. And it's a big deal because,
It is.
when you're protecting your healthcare. So in retirement, they say the second largest cost in retirement is healthcare, whether that be your premiums, but going to the doctor, going to the hospital. That's the second largest cost in healthcare. And so you just want to make sure that you just don't know what could happen.
Right.
You can try to do all the right things, and then you can have an unforeseen medical expense. And there's been a lot of innovations in healthcare, but it's very expensive, right? So, for a lot of folks on Medicare, they're on a fixed income.
Right. Like my
And if they
mom.
get, blindsided by a huge
Right.
medical bill, I mean, that can
Mm-hmm.
be devastating.
Yes.
So I always say we're like a fence builder. We build a fence around their nest egg from an unforeseen medical expense so they can go out and still plan to do the things they need to do. And if they have an unforeseen medical expense,
Mm-hmm.
they don't have a financial problem when they're going through a physical problem.
And I think that that's the thing. What I've been learning from talking to like Jenny and Ron,
Hmm.
like with Ron, it was like, oh, estate planning. Like you can already plan your estate and not even have to have a will because it's already taken care of, like whatever bits and
Yeah,
pieces.
yeah.
And with Jenny too, it's like, you're left to flounder. I've been dealing that with my mom, trying to get her into an assisted living home, and
Hmm.
they have me like running all over. I don't know, I'm
Right,
just learning as I go. I didn't know there was a person that could do that.
right.
And like for you, it sounds like there's like you can preemptively.
Sure. So,
Yeah.
so I've been doing this for coming up on 19 years, and so it's very important to have a broker. So a broker is someone that can go out and look at
That
multiple companies instead of a captive agent, which can only help you as far as that company is competitive. And
what's a
so,
captive like?
so would be a captive agent would be someone that only writes one specific company, whereas a broker can write multiple
Oh,
companies and look across the landscape and find the best solution for that individual need.
okay.
So it's not like, well, you need this plan. We're going to find out what's best to get your medications at the least cost, the hospital network that you need to go to. So really, it's the right fit for their individual need, not just a one size fits all. That's not going to be maybe efficient for a lot of folks.
And that's what I'm finding, like really, that it's the planning and that it's individually to you, that
Exactly.
you take care of it before anything hazardous happens. Do you know what I
Yes.
mean? Like you preempt that. And I want to shout out to your company name first.
Yeah. So our company is called Low Country Health Brokers,
Yep.
and like I said, we've been doing this for almost 19 years, and it's
Yeah,
it's very very important
it is.
because you do I always say I have these little analogies, but I'm kind of a car guy. So the more miles you put on your car, typically
Right.
the more maintenance it requires,
Yep.
and so you just want to make sure that you're in the right situation for your needs. And the industry does change. There's a lot of changes
Oh
that we're
my.
hearing about coming up, and so what happens is for a lot of folks is they don't know a lot of information about this, so they just make a decision and then they never touch it again. And it's kind of like my analogy there would be if you buy a car and you never do a front end alignment again, then before long you hit a couple potholes, you're going to be turning the wheel to the right to try to go straight. It's not efficient, so it's going to have premature wear on your tires. And it's the same thing with your health care. You need to be reviewing that on a regular basis so you make sure it's going to be
What you
efficient
need.
for your needs.
Well, and I'm guilty of that because here's the thing. It seems so complicated and so frustrating to me
Right.
that I just am like, okay, yeah, fine. I'll take that. Do you know what I
Right,
mean?
and that's what a
Like,
lot of people do, and then they end up getting, in a plan that's very expensive, that's
right,
not really suited best for their need, and and we hate to see that. So it's very
right.
important to find somebody that you like and trust that can review this and make sure that.
Exactly.
So I'll just really quickly
Yep.
kind of explain
Yes.
Medicare because we'll
Perfect.
go back to first grade and talk about the alphabet real quick.
Good.
So typically when you get on Medicare, you're either 65
Okay.
or you've been disabled for 24 months. And that's when you
Oh,
become eligible for being on Medicare.
didn't know.
Okay.
Okay. Yep.
And there's really two main parts to Medicare. There's Medicare Part A, which has to do with hospitalizations, and that's given back to you because you've paid Medicare taxes, your employer or your spouse has paid into the system, so you're getting that back.
Okay.
So that's hospitalization.
Okay.
And then Part B is doctors and outpatients. So emergency rooms, doctors, specialists, diagnostics like MRI, CT scans. And you have to pay for that. That's currently the standard rate in the United States is $174.70 for 24. And so those two parts are what make up or comprise Medicare. You have that comprehensive hospitalization and doctor coverage. But you'll hear things like D,
Right.
C,
Yes.
G. So the reason why no one should rely on Medicare alone is because Medicare, two main reasons. There's portions that Medicare require you to pay, but the big reason is that Medicare by itself doesn't have what's called a maximum out-of-pocket limit. So all the portions that Medicare would require you to pay can stack up as high as they need to without a limit in a given year. That's very, very dangerous on a fixed income.
Wow.
You want to have a limit. So most under 65 plans, you stop at, say, a $5,000 max out of pocket or
Right.
a $6,000, whatever
Yep.
it is. And so if you have a $100,000 bill, most you pay is $6,000. Well, on Medicare, that's not the case. You have to pay the 20% for outpatient, and then you have your hospital deductibles and things like that. So it's important to limit what we say, limit your exposure.
Right.
The second thing is that Medicare doesn't cover prescription coverage, so you have to go out and acquire prescription coverage alone.
Like, it's not confusing enough. Do you know what I mean? It's like, yeah, a lot of moving parts.
So here's the thing, though, to make that all very simple, on Medicare, you have A and B, which is your hospital and your doctor.
Right.
But then beyond that, there's only really two paths you can take on Medicare.
Okay.
Okay. You'll hear all the information you hear and see. It can all be stacked into really two piles. And those piles are, one, you stay with original Medicare and have a Medicare supplement and a drug plan. Okay. Or you have what's called a Medicare Advantage plan. Those are the only two broad paths that you can take on Medicare. Now, down each path, there's going to be some nuances and differences. And that's where other letters come in. So Advantage plans are also known as Part C. And Advantage plans include both medical coverage and prescription coverage, all combined in one. There are managed plans, so that means that the doctor or hospital interfaces directly with the insurance company. Okay. So that's where your Part C would come in. Then on the other path, which is a Medicare supplement, you have a supplement, which there are 10 standardized plans, and the industry really only uses about 2 plans now. It's either Plan G or Plan N.
We're going to get through the alphabet pretty soon.
And with that, Medicare is primary. Then you have your supplement, which will pick up the portions that Medicare would require you to play. And so it really does a really nice job of limiting your exposure.
Can I ask something? I don't just maybe like as you were talking, is Medicare state funded?
It's federal. Medicare is a federal plan.
Okay.
Federal, so it's federal. CMS, which stands for Centers for Medicare and Medicaid Services, is the regulatory agency that manages Medicare. So it's a federal program. States do have different options.
That's
as
where
far
I get
as
confused. Yes.
The supplements are all standardized across the state. So CMS has said that if a company is going to offer a supplement, a Plan G is going to be standardized to where if you go to different states or if you go to different carriers, it makes it easy to try to compare, because you're only really now at that point comparing on premium because the benefits are identical. Now on the Advantage plan, I mean, if you want to really get down to it, that's a zip code based plan. And so, some parts of the state you can have a certain amount of benefits, and the other part of the states, they don't have this option. So that's where it can become very daunting and confusing because there can be a lot of different options.
Right.
But that's where, in working with clients, you know how to determine what plan is best. And a lot of times it does come down to prescriptions, like
Right.
which plan is going to be best suited for the medication that a
That
client
you're
is
on.
on. Yeah.
Got it.
Yeah.
So when somebody reaches out to you, because again, you're a broker and you help people figure out what's going to be the
Absolutely.
best
Option for their need.
option for them.
Mm-hmm.
Okay.
Mm-hmm.
And so, and do you work with people, because you're from South Carolina?
Yeah, our office is in South Carolina, but we have our license in 7 other states.
Oh, wow.
So, and we're expanding
Right.
because we have clients that don't want to give us up when they move out of the state.
I bet. Yeah.
So it's good. But yeah, so we a lot of times people ask us how we get paid, and working with a broker, you don't have to pay us anything. I mean, we get commissions from carriers, and the commissions are all standardized, whether you go with this company or that company. So it's really a win-win for folks that want to know the facts and need help and want to make sure that they're on the right option. They don't. It doesn't cost them any more than if they went directly to an insurance company and got the same benefit, the same
You know,
product.
that's blowing me away because, like with Jenny, the senior living expert, didn't know there was anything out there that somebody could like help
Yeah.
you and be the point person.
Yeah.
And same thing. She's like, you don't pay me. I get paid from,
Exactly.
the placement
A lot of
price.
people say that. They say, we didn't know that there was
No,
someone out there
existed. Yes.
that does
No.
this. And so we always say when I help a client, I always say at the end, please don't keep us a secret.
Right. No.
You know.
And that's what I said when I found that out from Jenny, because I had gone through it and I had to do all the work myself. My sister's in an assisted living home, so I wanted to get my mom into it. So here's the thing too. So my mom, she has somebody, and that's the part too that I know in Minnesota. I've been trying to find. She has macular degeneration. She,
Wow.
It's advanced, so she's legally blind, and she only has $50,000 left.
Oh wow.
Yeah, that's a story we know. But so here's the thing. I wanted to get her into my sister's assisted living home. I thought that would be perfect. My sister's only 70. She's been there since she was 60 when she had strokes. And that would be great. So they won't tell me. I'm like, how much is this going to cost? You know what I mean? Just give me a ballpark,
Right.
And they wouldn't even do that. They're like, oh, you have to go through. So you have to I filled out all the financial stuff and, jump through all the hoops. And then you had to do an assessment. Okay. All she needed was help with her medication. Even at 94. Oh, sorry, it's bike week. Gavin and his wife are here for bike week, so that's a trike. That's a nice bike. And so I jumped through all those hoops.
Sure.
And then they're like, they don't even tell me how much it's. They're like, oh, we can get her in, and you're excited just for that. And then after we hung up, I'm like, oh, how much is? Because listen, she's only got 50,000. So I call back, and it's like, oh, it's going to be 5,400 a month.
Yeah.
Okay, and then I'm thinking, well, that's going to be sucked up in 6 months,
exactly.
And then they're like, oh, but then she can go on Medicare,
Medicaid. Yeah. So Medicaid is state. It's a state program where when you're impoverished, they step in and pick up the difference. But then at that point, you're kind of a ward of the state, and you go where there's availability.
And that's it.
And if there's not a room available close to where you are, then you have to go to one that is. It's not what you want ideally. That's not how you.
And so that's the difference again, because I get Medicare and Medicaid mixed up.
Yeah.
So Medicaid is state funded. That's when you're. That's when the
that's
state's
a financial.
helping you.
That's a financial stipulation, and that has to do with like if you're under 65, it has to again for long-term care facilities or for health insurance, you can qualify, or they can give you some assistance. That's a financial assistance program.
Okay. Yes. Okay.
Whereas Medicare is health insurance for those 65 and better.
Good to know. So here's the thing: when is the best time for somebody to come to you?
What we do, we can usually do it within a month, but Medicare is what sometimes takes a while, and so the time frame to sign up for Medicare is about 3 months before you actually need that coverage to be effective. So it'd either be for folks that are aging into Medicare 3 months before. And then if you are retiring and you're over 65, again 3 months before you retire, because it does take Medicare some time to get you all enrolled and then send you the
I bet.
card and all
Yeah.
that kind of stuff. It takes a
Yeah.
little bit of time. Our stuff takes not that long, maybe 2 weeks at the most. But a lot of times folks want to know what to expect, what is it going to cost, what is it
Right.
going to look like,
Yeah.
because they want a budget.
Right.
So, really within 6 months of you needing that to be effective, we can start that, conversation, so you have a great idea of what it's going to look like for you.
And so I was just talking to Amanda, and I didn't realize that. Okay, so you specifically deal with the Medicare part.
So I do. So I do those on Medicare, and then my wife Amanda does those under 65 that are not on Medicare. So combined, we can help anybody on an individual basis that needs.
So anybody
help.
who is like, even 45 or whatever,
Yeah,
just
absolutely.
looking to find out what the best
solution for their needs is.
solution.
Because if you have a couple, maybe the husband is going on Medicare, but the wife is only 62. Well, you don't want to leave her out.
Right.
She's going to have to find somebody else. But we don't want that. So we can take care of both their needs, and we communicate. And so when then the wife turns 65, then we just move her right on to Medicare. So it's a really good.
And I'm so blown away that I didn't know this. And like I said, I've been in the legal field. I worked in all sorts of legal things. That you don't have to pay. You don't have to pay for this service.
Right. Exactly. Yeah. Yeah. I mean,
why don't more people know this though?
I think, unfortunately, sometimes people maybe have experienced or hear of an experience where agents are very pushy and they're kind of scared.
Mm-hmm.
And so maybe they're kind of like hesitant
Leery.
to talk to someone because, they're going to try to cram something,
Yes. They're going to be sold
me,
something.
right,
Yeah.
that they don't really. And, unfortunately, that has happened, right? But that's not how we operate, because
Right.
we have a big, clientele base based on referrals. And
right.
So,
Right.
and we just want to do the right thing. It's a big
Right.
deal. We really care about what we do. Customer service has kind of waned in the last, couple years. And so we really try to provide that customer service, and it works well. Clients love it, and it's important. I mean, again, not to be a town crier, but there are a lot of changes coming to Medicare next year. And so you just want to make sure that you're doing the right thing, because I'd rather you spend your money on your family and on vacations and things, your hobbies that you want to do, not giving it to doctors and pharmacies unnecessarily.
Like coming here.
Yeah.
Exactly.
Yeah, do it on the fun things, not on the things that, you could have prevented. So.
Right. So I'm going to put all of Gavin and Amber's information down below. I mean, all your social media, contact information, everything else. And then I'll put like the states that you deal with.
Mm-hmm.
But for somebody, so how does somebody go about looking for a broker? And can you vet them? Do you know what I mean? Like, how would you know?
So for us on our, like, we have a really strong, a lot of Google reviews. So you can type in, that's where a lot of people have found us.
Okay.
Because, South Carolina is a area where a lot of people come to retire.
All right. Yeah.
And so they don't want to skip a beat with their health care.
Right.
So we get a lot of, Google searches and people finding us that way. So that's one way you can find, and then just look at their reviews.
Right.
I mean, that's probably the best way to do it.
And would you suggest, like, I mean, I don't know, again, like, is it something that you would talk to different brokers about and see what they say, or is it more like you find one and?
Well, it's kind of like, even when you find a doctor, I mean, you if you have to find somebody that you like and trust. I mean, even like think about like a mechanic. I mean, if that's a very important person, because I like cars, but I don't know how to work on them really,
Right.
And if I go in for a squeak and they tell me I need a new motor, well, maybe that's correct, maybe that's not, right?
Yeah.
So to sit down with someone or to talk to someone, we do a lot of phone appointments, but in 15, 20 minutes, you can tell if this is somebody that you like and trust based on how they're carrying themselves, what they're saying, or not. And that's but once you find that person, most people don't want to give that up.
So what's the process then of like reaching out to you, and then what happens from there?
So typically someone would give us a call, and actually you can also go to our website. My calendar's on our website. You can schedule a phone consultation.
Oh, really? All by yourself? Like you can just go in?
Yep, and they can schedule an appointment. And then I give them a call and I say, how can I help you? And we determine if it's like if they're aging on the Medicare or they've been on Medicare for a while, they just want to do a review and make sure they're on the right path.
Oh, so if you're already on it, you can call and
No,
see what that,
absolutely.
if there's a
Yeah.
better.
Yeah. We make sure. I mean, we have folks, again, that get on Medicare and they're afraid to talk to anybody. So they've been on Medicare for 8 years. And
Yeah.
it makes my day when, and I've done it. I mean, help clients save $2,000, a couple saving $2,000 a year
Oh my
for the
gosh.
same benefit. Same. So we're not carving out. We're not doing an apple to orange conversion. It's the same apple that they're currently consuming, and we saved them $2,000, and they're just so grateful.
And I'm a pretty good judge of character, and I can already tell like that this couple can help you. And so I see this, you put this out.
So this
What is this?
So this is a really, really good resource if you're on Medicare. It's Medicare and You. It'll go
Can
through.
you get it yourself?
You can. When you get on Medicare, they send it to you every year, and if you
Okay.
don't have it, you can always just go to Google.
I have a feeling people like phone books, they just toss it like this is night rating.
But what that's going to tell you is how often you can get a mammogram, how often does Medicare cover a colonoscopy, what about chiropractic care, what about immunizations, all that's going to be covered in there. And so you can go to Google and Google that, and it'll pull up a PDF file, and you can have that at your fingertips. But it's a really good resource to have.
Well, you have covered, like I said, I didn't know about the A, B, and then what the N and the
all the different alphabet.
And and so I mean, this has really been helpful for me. And like I said, a lot of times you sometimes fear things you don't know, so you don't even want to know. I mean,
right.
like if what you got is working, or not even working, and you don't even know, like naivete is bliss sometimes.
Yeah.
You think?
Yeah, some people feel like, well, I can afford it. Well, just because you can afford it doesn't mean that you necessarily it's the best, or you could even do better. I mean,
right.
So it's the fear of getting something. I mean, and I've seen it before. It's the fear of screwing something up,
right,
and having somebody, talk them into something that they didn't really understand,
right.
and that's not how it should be at all.
Right.
It should be a total benefit if you're going to make a change.
Well, and you should have nothing to lose then reaching out to a broker.
No, I mean, we have clients, we have folks that call us in, and I do a review,
right.
And I say, hey, for your situation, you're in the best possible position. There's nothing that you should do. You should stay right where you are, And so there are times, like if folks are on TRICARE, retired military, that's thank you for your service, but you don't need to work with us. I mean, you're already set up.
Right.
If you have Federal Blue Cross Blue Shield, sometimes it's better to go on, to use an individual plan than to be on federal, but sometimes not a state plan. Or if someone's already on a plan and it's the right situation, we tell them, hey, we're not just trying to get policies, we're trying to help clients make smart decisions.
Right. And that must feel good because you're helping people, but you're still getting paid, and it's helping them.
Yeah.
But they don't have to pay for the service, and it could help them save so much money.
Exactly. And we find that on Medicare, where most people wind up spending their dollars is going to be on medications. Medications are what really tend to cost the most money. So it's a win-win for them, for us, for everyone. Yeah. Everybody's happy.
Everybody's happy. So okay, I am going to put everything that you need to know to contact Gavin, and then Amber, they're leaving on Sunday, but Amber and I are going to have a Zoom call about her explaining what can help with the 65
under 65.
Yeah. So we'll get everybody covered.
Sure.
And then in the meantime, why don't you just shout out your website, and then people can go and schedule with you.
So our website is www.lchealthbrokers.com, lchealthbrokers.com.
Yep.
LC stands for Low Country. That's what they call the eastern part of South Carolina. So for those that wonder why it's LC, that's what it's for. But anyway, so you can just go there. You can see information about us. You can schedule an appointment. We'd be happy to help you out. And again, if you're in the right position, we'll tell you that. But that doesn't mean that once you do that your wheels are going to stay aligned for the rest of your life. I mean, maybe down the road you'll have a change.
You have to reassess. Yeah. So, and one more thing, the 7 states that you guys are brokers in.
All right. So we're licensed in, let me see if I can go from down. So we're in
It's like,
West Virginia,
uh-huh.
North Carolina, South Carolina, Georgia, Missouri, Florida, and Tennessee.
Oh, well, Florida must be a big.
It is, yeah.
Well, and that's the thing too. In Florida, everybody's retired, so it's a huge.
Yeah.
You know.
Yes,
Yeah.
absolutely. And there's a lot of different options in Florida. So,
Yep.
yeah.
All right. Well, Gavin, this has been eye-opening.
Yeah, thanks for having me on. We'd love to help
Yeah.
anybody that would like to make sure they're in the right position.
Yeah. And if you guys have like specific questions, maybe later on we could do a Zoom call together too. Like if other people have more questions about it, there just can't be enough knowledge. And like I said, I think it's the fear of like, if something's working, do you know what I mean? Like you just don't want to deal with it. Even if you're losing money, sometimes you're like, it's just too over here. Do you know what I mean? I got enough stress. I don't even care to like think about that, you know? But if your stress is money, you could be saving money. And
well, sometimes it's like, sometimes people have a certain ache or pain and they're scared to go to the doctor because they really, they're concerned what, and maybe it's something that can be taken care of very easily, or maybe, maybe it's something that needs to be addressed. But, it's important to, take a look at these things. And
well, do you know how many people I hear, like if I would know I would have to go to the ER, I'm like, yeah, I'll take an Uber there. Or do you know what I mean? Like, because they're like, oh, everybody's worried about like ambulance, it's going to cost $60,000. Like that's all I hear. So you're not taking care of yourself, even though you have insurance, which doesn't make sense.
I think everybody would agree that now with things, costs getting more and more expensive, it would be nice to have extra money in your pocket. So,
for sure. For groceries.
Yeah, exactly.
To stay healthy.
Yeah. So let's just make sure that you're in the right position.
That's right.
Exactly.
Okay, well, I'm going to put all the information down below. And if you guys have questions, leave them down below for me, and then I'll keep tally of them. And then maybe we can revisit with Gavin. But you can just reach out to them yourself, and they can help you. And then I'll be talking to Amber soon.
Very good.
Thanks, Gavin.
All right. Thanks for having me on. Have a good day.
See you guys in the next one.
Bye now.
Bye.